Hello and welcome to Community Partner Showcase. I'm Jarrett Cox with HCEC-TV and thank you so much for joining us. We have so many great organizations all throughout Hardin County that do great work for members of our community, and we want to showcase some of the great work that they're doing and tell you all about them. So today we have Jessica Daly, the Interim Director for the Community Healthcare Clinic, and David Peterson, a retired pharmacist that has been with the organization for all 21 years. Thank you so much for being here.
Thank you.
Thank you for having us.
So can you tell me a little bit about how you all got involved?
Oh, I have a story I could tell with that, but I'll try to make it short. I actually started as a volunteer with the clinic back in 2011. And then in 2012, I was offered the position of the Prescription Assistance Program Coordinator, and I have been with the clinic since. So I've been with them for 11 years now, and just cannot believe the great work that we've been able to accomplish over the years.
And I was, in 2001, the president of the Lincoln Trail Pharmaceutical Association, and Dot Hanson and Mel Moderman come to the organization and asked if we would participate, and I became a member of the steering committee at that time. And then as the program developed, I was able to become a board member and became the pharmacist in charge for the charitable pharmacy that we have listed with the Community Health Clinic, and I have been with them since then.
So as the chairman, I'm sure you're so proud about all the great work you've done for over 20 years.
Yes, I am. Dr. Hanley was the chairman of the board for 20 years. He has since retired and moved to Lexington, and been the senior member on the board. I was asked to step up and become chairman of the board, which I was glad to do.
So can you talk a little bit about what the Community Health Care Clinic, kind of the history throughout the years and what all services you offer? We started out as a clinic to serve the uninsured working poor of Hardin and LaRue County. And since then we've been able to expand to include LaRue, Meade, and Breckinridge County. And we have seen some patients who fell just outside of those perimeters, like they were from Jefferson, Taylor, Nelson, and some of the surrounding counties, but were referred to us through Hardin Memorial or Hardin Baptist now. We offer services of medical, dental, and pharmacy services, and some advocacy to help sign up people through Medicare and Medicaid. You know, one thing that I think so many people take for granted is when you need your drugs, you need your medication, like it gets expensive.
Very expensive, and we're able to assist. Primarily now we operate through what we call the KPAP program, and we have AmeriCares and Direct Relief that also provides some pharmaceuticals that we can distribute to the patients.
One of the things that I find so fascinating and so noble about the work that you do is almost everyone that works for you all does so as a volunteer.
We have 5 paid employees. We are the ones that run the office, and then we do have all of our providers are all volunteer. Most of them, it's after they've worked a full day in their office, and then they come to the clinic in the evening to see uninsured patients for free, which is absolutely amazing. And we're blessed to have each and every one of them. We do have, of course, Dave as his physician in the pharmacy, and 2 other pharmacists that volunteer their time. And then we have a nurse that comes in every week, and she is volunteer as well. So most of the people in the clinic are volunteer.
And that just goes just to show just the warmness that this community has. The fact that these people volunteer their time, especially after working a long day, to come back
Absolutely.
and help people in need. It's just so heartwarming. So this, you all opened your doors in April of 2002, and 21 years. It's just amazing.
Still going.
And still going strong.
Yes.
Yeah. We have seen some changes throughout the years, ups and downs in the number of patients needing assistance. When Obamacare took initiative, our numbers dropped, but they are slowly climbing back up as more and more people are needing the assistance of the clinic.
And now that COVID, the COVID emergency is ended, I'm sure that you're seeing more and more patients as some of those emergency insurance plans ended.
That we are, and one thing I would like to point out is during the COVID emergency, we never stopped seeing patients. Some of them were in virtual visits or teleconferences, but we still saw some patients in the clinic, and we actually did one-on-one by scheduling the patients, and with pharmacy, we actually delivered curbside, carried the medication out to the patient at the curb.
And I know, opening in 2002, you've seen so many things change, the Affordable Care Act, Connect ending and then coming back. So I'm sure that just keeping up with all this stuff and still doing all the amazing work that you're doing. And the Taste of the Heartland is a fundraiser that you all do every year to help raise funds, because it's not free.
Right.
What you do, it still costs money, even though people donate their time and their services to help with what you all do. I mean, there's still cost involved. So this is the first year that you all brought it back in full force. You kind of had a scaled back version of it last year, but this year, full force. Tell people about it.
We are excited to finally be able to, have a fundraiser where everyone can get together and we don't have to worry about wearing masks and, hand sanitizer and all of that fun stuff. We're actually having it at a new location this year. We will be at the venue, which is on Highland Sod Farm. So we're excited about that as well. So that'll be something new, as we're coming back into it. Just kind of looking to have a mini party instead of looking as it necessarily as, we're going to, going to a fundraiser again. We're looking to, get the community together and just having a good time.
The highlight of the event is the restaurants participating, and we're inviting all of our local restaurants to participate, and even the ones in our outlying areas of the counties that we serve. Any restaurant who would like to participate, we would love to have them. Bring one specialty dish, or if you can send servers to serve it, that's good. Or if you can only send a dish, we'll find someone to serve it for you.
And, this event is for such a great cause. If somebody hears this and they want to donate their time or their food, who do they need to contact?
Me. They can call the clinic. Our phone number is listed on our website. There's a lot of really good information on our website. Email address is on there. We have all of the forms and everything as well for the fundraiser on there. Also, we've got some glimpses of some of our auction items, which we're hoping will, draw some people in that way. But definitely either just by calling the clinic or sending an email.
And you've got so many fantastic items. You've got quilts and you've got handmade items, and we're going to show you just a few of those items here. I don't know who wouldn't want to bid on these items. These are just some fantastic items. They're homemade.
Yes.
Who wouldn't want that in their house?
Absolutely. It definitely makes it more special. It gives meaning. Every time you look at it, you can remember where you got it from. And, someone local took their time and love to put into that item.
And the money went to such a great cause.
Yes, absolutely.
And we'd like to also add that any of our bakers who have their own creative item that they like to donate, we would love to have it. We're looking for cakes, pies, fudge, any specialty item.
And I hear that you're still taking auction items if people are
Yes.
interested.
Those items would be auction items, and then any craft items that someone would like to donate as an auction item, we'd love to have them, yeah.
So the Taste of the Heartland, Saturday, August 26th, the venue at Highland on Hutcherson Lane. Now, if somebody wants to go to this, how do they attend?
Again, we do have the form on our website, and it has the sponsorship levels. So if they want to be a sponsor, and those sponsorships do come with tickets as well. Mm-hmm. And then you can also purchase individual tickets for $50 a piece. Mm-hmm. We do say tickets, but they don't actually receive a physical ticket. It's mm-hmm. more of just a placeholder to know that that they're coming. But definitely take a look at our website. All the information is on there. And if you have any questions, don't hesitate to give us a call or send an email.
And we'll have all the information at the bottom of the screen for anybody that wants to call, wants to get more information about the Taste of the Heartland or some of the services that you all provide. I know this is the first year that you're all back in full force, and I know that they'll need to get their tickets because it's going to be packed.
Absolutely. We're hoping so. That's what we're looking for. So we need everyone to come on down and just look forward to a good evening and getting some good items.
So is there anything else that you all want people to know about the clinic or what you all offer? Maybe something somebody may not know tuning into this?
Just making sure that people know that we do serve Hardin, LaRue, Meade, Breckenridge, and Grayson counties. If you are in an outside county, we absolutely, if you can get to us, then we will help you. We offer more services than just medical. We also offer assistance with applying for and advocacy with Medicaid, SNAP or food stamp benefits, the Child Care Assistance Program, and Medicare. We do a lot of assistance with Medicare, especially during open enrollment, which will be here before we know it on October the 15th. We do Medicare Part D plan reviews and renewals. So we're a one-stop shop when it comes to anything health.
And it's so important for people that need to apply for that, especially during open enrollment, because
Yes.
there's so many things, you can get overwhelmed pretty quick.
Absolutely. There's a lot to take into account when you're doing Medicare Part D review. There's looking at the medications, making sure they're going to be covered, making sure that they're going to be affordable for the client. So there's definitely, and then of course the Medicaid unwinding that is taking place over the next roughly 12 months. There could be a lot of people losing Medicaid, so we definitely need to continue and stay strong because there are still plenty of people out there that need the assistance that we offer.
And the fact, like I said, the fact that you offer that is just so heartwarming that, people volunteer their time to help people throughout all these counties, and you don't turn around anybody, so it doesn't matter where they're from or their background, that you will help them with any health stuff that they need.
Absolutely, and if we can't, then we've got plenty of contacts to get them where they need to be.
Thank you all for all the great work that you do for our community. It is so special and so important that someone like you all are offering the services that you do for the people in our community that need that help. www.thecommunityhealthclinic.com, 270-763-9589 if you want to contact you all to get more information either about the Taste of the Heartland or the work that you all do. And of course your fundraiser, the Taste of the Heartland Saturday, August 26th at the venue at Highland on Hutcherson Lane. Tickets start at $50, and of course you can become a sponsor, and all that money goes to help with all the services that you all provide. David, Jessica, thank you so much for being here.
Glad to be here.
Thank you. Yes, thank you for having us.
And thank you so much for joining us. For HCEC-TV, I'm Jarrett Cox, and I'll catch you down the road.